Yeah, sure. So we've concentrated quite a lot on the physical sides of this condition, which is really normal because, it's so easy to describe vomiting and nausea. But the mental health impacts of HG are alarming. The statistics are shocking. So HG sufferers 8 times more likely to suffer with antenatal depression, 4 times more likely to suffer with postnatal depression. 20% will be diagnosed with PTSD. And in terms of suicidal ideations, and we've recently had the news feature and our documentary launch, which is called the Jess and Baby Elsie story, which was about a really tragic case of a complete lack of care, which was experienced by Jess when she was suffering hyperemesis, which sadly ultimately led to her death, and that of her baby Elsie at 28 weeks pregnant. So the mental health impact when it comes to things like suicidal ideations, nearly a quarter will have suicidal ideations occasionally, and then nearly 7% of sufferers will regularly think about suicide, which you just can't compute really when you're thinking about being in this pregnancy period, and it's supposed to be all wonderful, and yes, there's some difficulties to it, and other things that come into it, but that's how debilitating HG can be. So we can't ignore the mental health impact. So we launched this in March. It's called A Month to Change Minds, where we're taking a good month to really look at the mental health impact. We've got the documentary, the news feature, other items on our website, and then the campaign will actually finish on the 13th of April now, because we were really lucky to get some big give match funding, and we're raising money to provide or continue to provide the service that I haven't spoken about yet, which is our counselling service. So we have a specialist HG counselling service, and the service exists. People can pay for the service, but our aim is to have fully funded sessions so as many people can come and access counselling as possible, because there is a real barrier to getting mental health support in this country with wait lists, and lots of other reasons. So the counselling service is really precious to us in terms of being able to support those who are currently suffering, but more as well as, which is as important, given the statistics in terms of the postnatal period as well with PTSD and depression. So that's our big push at the moment.